Welcome to 52 Questions. I'm Shannon Weber, Director of Hive. Every year, Hive answers hundreds of questions from patients and partners and providers, and each week in 2018, we're bringing one of those frequently asked questions to you in video format. And for this week's question, I've come to Dr. Smikle's office at Laurel Fertility Care to get the answer to the question, what is sperm washing and how is it helpful for men living with HIV who want to have a baby?
So, well, thanks, Shannon, for actually that introduction. And what we can do is to talk generally about what is sperm washing, and then talk specifically about how it would involve men with HIV. So sperm washing involves concentrating sperm in whatever form into a much smaller solution and using that to be transported into the uterus or into the cervix in patients who are trying to get pregnant. That involves taking sperm, typically sperm that actually has a good number of moving sperm within the sample, washing its sperm, washing out all the semen particles, then basically putting it into a smaller solution, typically about a 0.5 milliliter, and then putting that directly into the uterus. It's used by putting a specific catheter into the uterus. It's not a very painful procedure to do, and that puts the sperm closer to the eggs when the woman's ovulating. Now, in patients who are HIV discordant, men living with HIV, you can do the same things. One challenge is that sometimes the medicines used for treatment may end up lowering the sperm count, so therefore you may end up having to hold and restrict ejaculation for some time period just to make sure there's a sufficient number of sperm, but the parameters are the same. All you're doing is washing out all the particles that are actually within the semen that may contain the HIV virus. Typically, washing it will remove all the white blood cells, all the other particles, and the material that then transferred, the ones that are left behind, are the actual sperm. And many reports show that those sperm do not contain the HIV virus, and they can be inseminated into the uterus or into the cervix without causing a problem.
Okay, so the sperm washing itself is a procedure that's done for all people seeking fertility services, or just for people who are seeking fertility services where it goes directly inside the uterus? I guess I don't know that part either.
So it's something that's done by a lot of couples. So lesbian couples go through sperm washing all the time as an initial measure to get pregnant. And so that's something that they may do with medication or without any medications at all. So that's very common. Young women who are trying to get pregnant may actually try that as a way initially because it's a very inexpensive way for them to try to get pregnant.
Got it.
So that's a lower cost, lower technology-based method, but that's relatively effective in terms of patients trying to get pregnant.
All right, great. Super helpful. Thank you for joining us, and join us next week where Dr. Smikle will answer the question, what is the cervical cap method, and how might I decide between the different methods which one's best to get pregnant? Have a good week.